Good day, and welcome to this lesson on respiratory clinical pathophysiology. In the previous session, we looked at cardiovascular clinical pathophysiology. In the session, we said that the cardiovascular system maintains tissue perfusion by keeping blood flow, which is the cardiac output, and vascular tone, which is the systemic resistance, high enough to deliver oxygen. By the end of this lesson, you will be able to explain gas exchange and what fails when oxygenation or CO2 removal is impaired. Explain ventilation and recognize when it is inadequate. That is ventilation failure. How does gas exchange actually work? Gas exchange is the core purpose of the respiratory system. It is the process by which oxygen moves into the blood, and carbon dioxide, CO2, moves out of the blood so it can be exhaled. For this to happen, two things must occur together. Air must reach the alveoli, that is ventilation, and blood must flow past the alveoli, that is perfusion. Inside the alveoli, oxygen moves from the airspace into the blood, while CO2 moves from the blood into the alveoli to be breathed out. This exchange maintains organ function. Without stable oxygen supply and CO2 removal, cells cannot produce energy effectively. Over time, this leads to organ dysfunction. A patient can still be breathing and gas exchange can still be failing. Why? Because breathing movements alone do not guarantee that oxygen is transferring into blood. If air and blood are not properly matched in the lungs, oxygen transfer will fail even when respiratory rate looks normal. Now that we have seen how gas exchange works, now let's see what determines ventilation and perfusion. Let's start with ventilation. Ventilation is simply air moving in and out of the lungs. But clinically, ventilation is not just counting respiratory rate. It depends on respiratory rate, depth of breathing, open airways, and strength of breathing muscles. When ventilation is poor, carbon dioxide cannot be removed properly. This leads to carbon dioxide retention, respiratory acidosis, progressive muscle fatigue. Fast breathing does not always mean good ventilation. A patient may breathe rapidly but take shallow breaths. Airways may be narrowed. Muscles may be tiring. So the number alone is not enough. Effectiveness matters. Now, perfusion. Perfusion refers to blood flowing through the lung vessels. Even if air reaches the alveoli perfectly, oxygen cannot enter the blood unless blood flows past those alveoli. If perfusion is reduced or blocked, oxygen transfer fails despite normal ventilation. This is why respiratory compromise is not always an air problem. It can also be a blood flow problem inside the lungs. You can have air in the alveoli, but without blood flow past them, oxygen cannot transfer. Now, let's match ventilation and perfusion together. Ventilation, V, and perfusion, Q, must be matched. If air is present but blood is not, oxygen cannot enter blood. And if blood is present but air is not, oxygen cannot enter blood. In normal ventilation and perfusion, air reaches alveoli. Blood reaches alveoli. Oxygen enters blood normally. In low ventilation and perfusion, low ventilation and perfusion occurs when air is reduced, but blood flow remains normal. Examples are pneumonia, asthma, airway obstruction. These results in oxygen entry drop and hypoxemia development. In high ventilation and perfusion, blood flow is reduced but air is present. Examples include pulmonary embolism and low cardiac output. As a result, ventilation is wasted and oxygen delivery falls. A patient may be breathing and even receiving oxygen, but it can remain hypoxic if the underlying ventilation and perfusion mismatch is not corrected. In summary, gas exchange is the main function of the respiratory system. Oxygen moves into the blood, while CO2 moves out to be exhaled. Effective gas exchange requires air reaching the alveoli and blood flowing past the alveoli. Then, inside the alveoli, oxygen moves from air into blood, and carbon dioxide moves from blood into the alveoli. That is it for now. We shall continue the lesson in the next class. Thanks for watching. See you in the next lesson.